program. My name is Joseph Mass, and I'm your host for today. And as always, we are just fortunate to have you viewing with us. And we're also fortunate to have in our studio today Dr. Beaumont, Gilles Beaumont, and Dr. James Henry, and they are both from Mobile Chiropractic Associates. Gentlemen, welcome to the program on today.
Well, thank you for having us.
Well, let's begin on today. First of all, and Dr. Beaumont, I'll begin with you. This is your first time in our studio, first time on the Joy program, and so it would be appropriate to share a little bit of your background and let the viewers know who you are. So could you give us a little background?
Well, I've been a chiropractor for 37 years, and starting my 37 years. During that period of time, I've done my study. First of all, I've done my study in St. Louis at Logan College of Chiropractic, which is called now Logan University. And after graduation, I went to Canada for 3 years. I'm originally from Canada, you can tell from my accent. Right. And then moved back to Michigan, where I practiced 9 to 10 years, and then came back to Alabama down here for the past 25 years. So wow. I've been a resident of Alabama longer than everywhere else, I think. During my course of the years, I've taken a lot of postgraduate work. I've done some in insurance claim review, and also done a certification in industrial consultant, where we go and do ergonomic analysis of work sites. And then also I have excessive hours in chiropractic orthopedics, about 600 to 700 hours in that, which is specialized into a diplomate degree. So I have been quite a bit around in the last 37 years, and then also focus a lot of my practice on nutrition.
Okay, awesome. Dr. Henry?
I'm Dr. Henry. I'm a 1965 graduate of the National College of Chiropractic, which is now the National College of Health Sciences in Chicago, Illinois, actually Lombard, Illinois. I got into the profession because I always felt that we were that we had an alternative, and I consider myself an alternative practitioner. I've done clinical research in nutrition for the last 22 years.
Wow, very good. Now, I guess a little note. Both of you, as I was reading your bio, I guess you would say, both of you are you came from Michigan to Alabama.
That is correct.
Yes.
Did y'all know each other then?
Yes.
Okay.
Slightly. The first time that I really, James knew more about me because we used to attend the same seminars. Okay. And one time I was on the stage as a delegate testing person, and he remembered me. But when I first came to Michigan and I had to go to a meeting here, he was the first person at the meeting that I saw, and he said, "You're from Michigan."
I tried to distance myself, but he showed up anyway. So.
Okay.
But strangely, we're both from Michigan.
Wow. Now let's do this. We brought you here, and I would start with this. We've all seen the commercials on television, and it would say something like, "Ask your doctor if this medicine is right for you," and it would give you a whole list of the things that it's supposed to do for you, and then it'll turn around and give a list of the things that it might do to you, and negative things, and so it's some concern out there with the medicines that people are taking, and you even gave a statistic that the 4th leading cause of death in this country is what?
It was from prescription medication.
Wow.
And that was not coming from me. It was from a medical letter written by a medical doctor.
Wow.
That I just, matter of fact, got this week. So.
Wow. And so there is great concern, or should be concern, with things that we put in our bodies in the pursuit of being healthy and trying to be healed and so forth. And I want to say this, that we're not here bashing medicine or doctors or what have you, but what we have brought you gentlemen, you doctors here for, is to explore an alternative approach to healthcare. Can you expound on that, this concept of this alternative approach as opposed to the way we may normally deal with a pain or a concern in our physical body?
Well, like you said, we are bombarded daily and multiple times daily by ads about the benefit of drugs and medication. And of course, like you said, there's a lot of side effect to that. And we're the only one that knows that. People that take the medication know that. Some of them do react. The medical doctors know that. Right. And so everybody is well aware of the side effect of medication. Sometimes it's needed. I mean, I'm not going to bash that. If you have a bad infection, you're in the hospital, they have to do some IV,
exactly.
Life-threatening situation, that's fine. But I don't see medication being an answer to lifelong therapy. In other words, I wouldn't want to see somebody on NSAID or non-inflammatory steroid medication for 30, 40 years. It would be counterproductive. Matter of fact, it would damage the body. Right. And that is well known within the medical profession. Right. So what we have to offer is we look at the body a little different way, or the condition a little different way. We look at the physiology of the body. How this condition developed? What happened? Into the history that we take with the patient, like any other doctor would do, and we find out, how did this condition start? Sometimes it started maybe 5, 6, 7 years ago by somebody changing the way they eat, the environment in which they work, stressors, we call, and then they didn't realize that it happened so slowly, gradually, that they develop a condition. I hate to call them disease, because sometimes they're not disease, they're kind of man-made. We made them ourselves.
Right.
So by looking at it and find out what caused that to start with, how it affected the body, the physiology, how did the organ respond to that, whether it's the endocrine system, whether it's the digestive system, the respiratory, the cardiovascular. Once we have an idea of what's going on, then we can formulate a natural way of maybe coping with that. Now, they might be on medication some, so we have to work a little bit with our medical doctors to make sure that as we improve the physiology, they reduce that medication, because as we improve this, and then they're on blood pressure for high blood pressure, and the blood pressure naturally goes down, they're going to be taking too much medication, which could cause them to have some serious problem.
Wow.
And I had that happen to me in my office not long ago, where suddenly the patient's blood pressure kind of came back to more normal, because we were doing this natural therapy, and ended up having to go to the hospital emergency room just to be cut down from one of his medication and cut their second one in half. And then they did cardiovascular, and even his cardiac output was improved. Wow. So that's how good natural therapy can be, because we were strengthening all of the tissue of the heart and, and the kidney and all those things.
Can I